I welcome you on my channel Step 1 Insights. Let's start. A 3-week-old girl delivered at term with no complications is brought to the physician by her mother because of a 1-week history of yellow eyes and skin, tan-colored stools, and dark brown urine. The newborn has been breastfeeding without difficulty. She is alert and appears to be in no distress. She is at the 50th percentile for length and weight. Physical examination shows scleral icterus and jaundice. There is mild hepatomegaly. The spleen is not palpable. Laboratory studies show hemoglobin 14.4 GDL, hematocrit 43% leukocyte, count 8000/MEM3, serum albumin 3.5 GDL bilirubin, total 14 mgdl, direct 12.5 mgdl AST 50 UL ALT 45 UL. Which of the following is the most likely diagnosis? In the clinical scenario presented, the 3-week-old girl exhibits signs of jaundice, as indicated by yellowing of the eyes and skin, and the laboratory results show a high total bilirubin with a predominance of direct, conjugated bilirubin. In neonates, jaundice can have various causes, and the presence of direct hyperbilirubinemia typically points towards a disorder in bilirubin processing after it has been conjugated in the liver or an obstruction in the bile ducts. Here's a brief overview of the conditions listed. Biliary atresia, a condition where the bile ducts are scarred and blocked, leading to a buildup of bile in the liver. This can cause jaundice and is often associated with pale stools and dark urine due to the inability of bile to reach the intestines. Crigler-Najjar syndrome, type 1, a rare genetic disorder where the enzyme that conjugates bilirubin is nearly absent, leading to high levels of unconjugated bilirubin. However, this would not typically cause direct bilirubin to be high. Gilbert syndrome, a mild hereditary disorder affecting bilirubin conjugation. It typically causes mild jaundice but would not explain the high direct bilirubin. Hemolytic disease of the newborn. This occurs when there is an immune response against the newborn's red blood cells, leading to increased breakdown and high levels of unconjugated bilirubin. Physiologic jaundice. This is common in newborns and usually resolves without treatment. It's characterized by elevated unconjugated bilirubin in the first week of life. Given the high levels of direct bilirubin and the clinical signs of obstructive jaundice, dark urine, and pale stools, the most likely diagnosis from the options would be biliary atresia A. This condition is characterized by direct hyperbilirubinemia because the conjugated bilirubin cannot be excreted into the intestine due to the obstruction. The laboratory values do not suggest hemolysis, normal hemoglobin, and hematocrit, which would be present in hemolytic disease of the newborn. Additionally, the age of presentation and symptoms do not align with physiologic jaundice or Gilbert syndrome, which typically show predominantly unconjugated hyperbilirubinemia. It's important for a physician to confirm the diagnosis with further investigations, such as imaging studies to assess the biliary tree and potentially a biopsy to assess liver pathology. Thank you for watching this video. Subscribe my channel, click like, and never give up.